What does your consent form look like? What do you think are the important, poignant aspects that the patient needs to know that they are signing off on?
I think the medical consent form, and no matter what we do as physicians, is a medical legal document to protect us. There's no worse feeling as a physician, and I'm sure all of us who have been practicing long enough have had some complication where you want to go back to that consent form and make sure that it's written down there and the patient's signed and dated it. So I think everything you can possibly conceive of that could go wrong should be on that consent form. I think the companies do a pretty good job of it.
I tell them that there's inherent risk in everything, right? It's a lot like driving a car. Like, everybody's going to eventually get in a fender bender, but there's very few head-on collisions. So the fender benders are the obvious stuff, and the head-on collisions are blindness and death that are very unlikely to happen. But it's a risk, and if they're not willing to take any risk whatsoever, they shouldn't do it.
I think it's more of a moral issue than a legal issue, and I know this sounds a little strange, but even if you had that in your consent, I mean, if you inject someone and they go blind, they're probably going to win. It doesn't matter if it's in your consent, doesn't matter if you talked it over with them. They're probably going to be compensated. To me, it's more of a moral issue. Amy said, I don't know if I could practice if someone went blind. And to me, it's more about telling them that it's possible, but extraordinarily unlikely, and you've never had it in your practice, and you will do everything possible to make sure that doesn't happen.
I think then we could say unanimously that we all feel quite strongly that the issue of blindness does need to be included in the consent form. You need to check with your malpractice company to find out how often you need to reconsent, even when you're doing the same procedure, that patient, so that we all know we're working within what our regional variations may be. So I think that's very, very valuable.